Hello, welcome back to Little Green Bonds, a channel where we break down complex topics into easy to understand nuggets. And today we're diving into an important topic that you might not have heard about before, but it's an important one. It's called neurofibromatosis. So neurofibromatosis is a condition that affects many people worldwide, but or not to break it down so you can understand what we're talking about. What is neurofibromatosis? Neurofibromatosis. It's a genetic condition that causes tumors to grow on nerves throughout the body, and these tumors are usually benign, which means they are not cancerous. However, they can still cause a range of conditions, and the sizes of these tumors can vary from very small to very big, and they can be in almost any location in the body. There are three main types of neurofibromatosis, or NF. So there's NF type 1, which is the most common type. There's NF type 2, which is relatively rarer, and then there is the other different type, which is called Schwannomatosis. So like I said, NF type 1 is the most common type. It's usually common in children, and it can cause skin changes which often comprise benign growths on the skin or even under the skin. In NF type 2, which is a less common kind, it commonly leads to tumors on the nerves responsible for hearing and balance. While the Schwannomatosis, it's much rarer of all the types, and usually affects adults and causes painful tumors on nerve tissues. Our focus today will be on the NF type 1, or neurofibromatosis type 1. What are the symptoms of NF type 1? So the symptoms can vary, and even within the same type. So let's go over those. The most common one is cafe or lay spots. So these are bright brown patches on the skin, and they often are the first sign to be seen. You can also have neurofibromas, which are soft benign tumors that grow on or under the skin. Another third feature is freckling, usually in unusual areas, commonly in the armpits or in the groin. Another feature is leash nodules. These are tiny harmless spots that are seen in the iris, that's in the eye. Another that's of importance to us is the bone deformities. So these bone deformities are seen in the spine, and they can cause scoliosis or associated scoliosis. Another bone deformity is can happen in the leg, and it causes the condition we previously talked about called congenital pseudoarthrosis of the tibia. So how do we diagnose neurofibromatosis? So the diagnosis often starts with a thorough medical examination, which comprises a clinical assessment and radiological investigations. Specific signs like cafe spots and neurofibromas are very helpful in helping to narrow down the differentials to whether it's neurofibromatosis or something different. Imaging tests are also important, so things like MRI can be employed, especially when looking at tumors in different locations of the body, particularly the spine. So now let's talk about treatment of neurofibromatosis. So it's important to know that there's currently no cure for neurofibromatosis, but the symptoms can be managed. So in the orthopedic perspective, the conditions that we need to take note are scoliosis and congenital pseudoarthrosis of the tibia. We previously talked about congenital pseudoarthrosis of the tibia and talked about the different management options. So just check out this video here so that you can learn more about that. The other condition, which is scoliosis, is something we've also talked about before, and the treatment can vary from bracing to surgery to try and fix the alignment of the back. Other treatment options available are things like physiotherapy, and this is done to improve mobility and to help with mobility issues in these patients. Because these patients can suffer from different pain syndromes, they can also see the pain specialist to manage that. Another condition that's associated with the neurofibromatosis is limb length discrepancy. Because neurofibromatosis can be associated with the features of gigantism, especially in the lower limbs, it can cause the leg to grow faster than the other and ultimately contribute to limb length discrepancy. So when this happens, the treatment is instituted to try and slow down the leg that is growing really fast. And that's something we've discussed before when talking about limb length discrepancy. So neurofibromatosis is a lifelong disease. So remember, regular checkups and early intervention are very important. They can make such a big difference. So thank you for tuning in today. And as always, don't forget to subscribe, give us a thumbs up, and to like the video. Keep it on Little Growing Bones. Thank you.